Welcome back to the Woven Well podcast. If you've ever struggled to conceive a pregnancy, then you likely had your AMH level tested at some point. Some consider this to be the most significant indicator of a woman's fertility, but is it? Is pregnancy impossible for women with a low AMH, or is there anything that they can do about it? Well, I've invited a guest expert to answer these questions for us and give us some much needed education on AMH. Today, we're talking with Dr. Codruta Pandaleche, who is a physician specializing in restorative reproductive medicine. She's in Ireland. She's been there the last 18 years, and she previously worked at the NeoFertility Clinic with Dr. Phil Boyle, and she's now opening her own practice. She focuses on preconception and conception and brings over 16 years of clinical medical experience. She has a special interest in low AMH and recurrent pregnancy loss, and I cannot wait for her to share. Dr. Codruta, welcome to the show.
Hi, Caitlin, and to all the listeners. Lovely to meet you all. It's an honor to be invited to the lovely podcast, and I hope that I will be able to clarify a few things regarding to AMH and fertility.
I have no doubt that you will. I'm excited to go through so much with you. So let's start off by hearing, what does AMH actually tell us? What would be considered a low AMH level?
First of all, I think it's very important to know what is AMH because everyone is just panicking regarding AMH and low AMH. So an AMH test measures level of anti-Mullerian hormone, which corresponds to your egg count. Although it's connected to your egg count, it won't predict your fertility.
Hmm.
An AMH test is basically a simple blood test that you can have with your doctor. So when it comes to low or high, um, a little definition: higher AMH levels mean more eggs and a higher ovarian reserves, and the lower AMH levels mean fewer eggs and a lower ovarian reserve. But again, it will never predict your fertility. And one note to keep in mind that even if your AMH levels are in the typical range, other factors may influence your ability to conceive. Okay. When it comes to range, it really varies depending where you are in the world. Providers usually measure AMA levels in nanograms per milliliters. In Europe, we measure it in picomoles, and that will make the values being slightly different. An example of a lowest value for a female age 35 to 39, this is what we see in practice in general, would be 1.05 picomoles, and the highest would be 53.5. So what do we consider a low AMH? If anyone would see themselves on the lower end of their range, so I consider a low AMH of an AMH of 1 or a 1.7 or even 2. But we have worked successfully with couples who have AMH below the 1. So let's say low would be under 1 nanogram per milliliter.
Okay. And I bet a lot of people listening are already surprised by what you're saying because you are giving very low numbers, but then saying it is not a predictor of your fertility. So that's not what they're hearing when they go to work with a reproductive endocrinologist at an IVF clinic. They're not told that information. It seems like AMH is a direct predictor because it seems like, well, that's how many eggs are left and it must not be a lot.
Mm,
So maybe break that down for us, the
yes.
differences there in those two approaches.
So first of all, everyone has to be aware that AMH levels naturally will decline with age. Okay, so it is normal to see a lower ovarian reserve in your 30s, 40s, or 50s, obviously. What we can see in the practice is premature ovarian insufficiency, which is slightly different, and it will put you under a low AMH risk group uh, before you age, before you're 30. Okay, how we see things differently, you're right. From the IVF point of view or your other healthcare providers, you have low AMH and you panic because you think that you don't have any more eggs. From the restorative reproductive medicine point of view, we look at the AMH as a value, not as a fertility predictor. And I tell all of my patients, we only need one egg every month. We don't need 2, we don't need 30, we don't need 10. So
Yes.
this is where we come in differently and we approach it differently. And for us, a low AMH, it's definitely not a problem of conception. You only need 1 egg every month in order to be able to have a healthy pregnancy. So the other clinics will say, well, you need a high AMH. But why is that? Because they want to overstimulate the ovary to be able to collect 10 or 12 or 14 follicles, eggs, in order to give you a better chance of having maybe 5 or 4 or 3 embryos at the end of that cycle. But we don't do that. We use 1 egg at a time, and we will want to make sure that that egg is a very good quality egg rather than quantity.
Yes.
I want to make sure that people know that a higher AMH level isn't always a good thing. You know, we
Mm.
will see higher than the usual in people with, for example, PCOS, polycystic ovarian syndrome. Okay, so yeah, no, if you have a high AMH, it's not necessarily a good thing. So this is where we come in differently, and that's why you will hear us restorative reproductive doctors saying that AMH is not a problem, and then you will hear other clinics saying AMH is a problem. And usually this comes with a big bang where you're told that you need donor eggs because you don't have
Mm.
sufficient eggs. And this, I think, it's heartbreaking for every couple that they're going through infertility to hear. So yeah,
Yes.
this is why we're different.
Absolutely. So that's encouraging, I would imagine, for anyone listening. So, are there ways then that restorative reproductive medicine works to increase the AMH? Is that possible to do? And have you seen any success in your patients?
Yes. So the answer to both questions is yes. Um, when we look at the egg quality, we know that the egg quality is influenced by mitochondrial health, which is the cellular health, oxidative stress, nutritional status, the emotional well-being, genetics, general health in general. Uh,
Hmm.
um, the environmental factors are important, and obviously hormonal balance. So all those factors will play an important role in egg quality. We are hoping that with every single treatment that we are going to give to the patient who has low AMH, we will improve not only the value of the AMH into the next maybe 3 to 4 months, but we will improve the egg quality. Okay, so we are giving each patient a very individualized treatment plan. There's no 2 patients who will respond the same to the same treatment. So with restorative fertility medicine, we create a very individualized plan, and we usually see very good outcomes. Either they get pregnant, which is exactly what we want, or I had patients where they just wanted a repeat AMH in 3 months. And I was pleasantly surprised to see not only once, but multiple times an increase in their blood test. So I had somebody who came in and said, actually, I'm not pregnant yet, but I'm so happy. My AMH is now 7.2 from 1.6 or 1.5. And I was like, oh my God, that's a win. It's a win in
Yes.
itself because that means that we're doing things the right way. So this is how we work with people when it comes to low AMH. And yes, we do see not only an increase in their AMH, but also we see the pregnancies coming in. Um,
Yeah.
yeah, a nice story. I actually, it's even on my Instagram page. I posted it not long ago. A beautiful story. A couple who came to see me in the clinic in NeoFertility. They were both 34 years old. They're trying to conceive since 2021, so about 3 years of trying to conceive, never pregnant and never miscarried. The lady had endometriosis, which was removed in 2023, and a low AMH of 0.9, zero point
Wow.
0.9. They were advised IVF with donor eggs because this is what they're doing when you have low AMH. Um, we've identified that she's ovulating but with low hormones, and that tells me as a provider that the ovulation event is not quality. Um, they both had higher than normal BMI, and we actually identify a male factor. So the DFI was high. So there were a few things going on in the same time. So the AMH was really not a problem from my point of view. The good news is that they were pregnant after their first treated cycle, which is absolutely beautiful.
Yes, wonderful.
We performed a scan at 7 weeks, an ultrasound, and then we performed a second ultrasound at 9 weeks. The 7 weeks and 1 day ultrasound was measuring perfectly normal. The blood results were absolutely balanced, and everything was perfect with that couple. They gave birth to a lovely baby girl. We did implement a lot of things in the month and a half before they've conceived. Lifestyle, nutrition advice, very important. It's all starting with being healthy in general. I have a saying, and I love this: a healthy woman will be a fertile woman, and a healthy man will be a fertile man. So get yourself to a point where you say, I am healthy, you will be fertile. So we've
Mm.
supplemented both female and male accordingly with their blood results and their needs. And then on the first medicated cycle with follicle stimulation and luteal phase support, they've conceived. Yeah, I was absolutely grateful to see that result coming in so quickly after their struggle. Um,
Yes.
and like, they came and they said, no, everyone said we're not going to have a baby, and now they have their little baby girl.
Mm, that's
Actually, they got in touch with us for a second baby, just
oh,
not long
wonderful.
ago. I know, and it's just so beautiful to see,
Yes.
people really um, getting to know that low AMH, it's not a problem. It is not a
Mm.
fertility diagnosis. I know it's a big no for the majority of the world. Um, as I was discussing with you and with every other person that I'm talking about, the restorative fertility medicine is not well known yet. Um, and it's just beautiful because you do work with the individual and for their needs, for their personalized needs.
Yes.
So, yeah.
Making it so individualized and honoring the human being that's sitting in front of you as unique and unrepeatable. No one else will be exactly the same as that unique woman. And so honoring her by truly treating her specific concerns and seeing what she needs, not just giving the same treatment to every couple that walks in the door. It makes such a difference. And we completely agree with you, here on the podcast, we completely agree with you
Yeah.
about overall health and
Yes.
how that greatly influences because we often try to separate all the different systems of the body, but we
Yes.
are one person. And
Yes.
so all of our systems work together. The digestive system is going to affect the reproductive system. The adrenal health is going to affect the
Yes.
reproductive system. And
Yes.
then also, we are mind, body, spirit. And so we want to make sure that we're healthy in all of those ways. And
Yes.
because it's not just based on one value like AMH, it
No,
is the whole person and the whole health. Not to say that there aren't things that we can do to improve the AMH level, but it's within the context of improving our overall health as well.
of
So,
course.
we've talked about ways before we started recording, some ways that you could possibly increase the AMH level.
Yes.
What recommendations would you have for a listener who maybe knows that their AMH level is low and they want to do something to address that?
Yes. So, first of all, um, they should either investigate possible causes of low AMH. Um, you know, that can definitely be done. And if you know that you have maybe um, autoimmune diseases, I see this a lot. People that have autoimmune conditions can present with low AMH, okay? Try identify the cause, and if you can fix it, that's going to help as well. But in general, supplements, and I know that there's so many supplements out there, but now talking about supplements and AMH, it was a very good study that was published by PubMed. Is actually anyone can look it up, um, in related to micronutrients and increasing AMH. A total of 244 women were included in the study in Austria. They were all treated with a mix of supplements, so omega-3 fatty acids, coenzyme Q10, vitamin E, folic acid, and selenium were used to treat those 244 women for 3 months, daily for 3 months. And the data is really good because um, the this micronutrient supplementation has a positive effect on serum AMH levels, so on their results. Also on endometrial thickness, ovulation frequency, and luteal phase duration. So it's really risk-free if you're thinking that every single nutrient that was micronutrient that was used are basically supplements over the counter. Okay, so I would say to someone who wants to improve their egg quality, um, to maybe discuss with their healthcare provider in order to get the right advice when it comes to supplements. But I think every single person that lives in this world should be on a very good supplement of omega-3 that contains DHEA and EPA. Not all supplements with omega-3 contain those two very good things, EPA, DHEA. Also, trying to conceive, you want to be taking folic acid, as everyone knows it, a good supplement of folate, and also an antioxidant like coenzyme Q10. I personally love CoQ10, but there's another one that I really like. It's called alpha lipoic acid. So they're all supplements, and they all work together to bring the quality of the egg to its best. But obviously, not only supplementing things will help. You want to look at the bigger picture, as we both said. Restorative fertility medicine looks at the whole picture, and we're trying to identify all the factors that are there working against you to get pregnant.
Absolutely. Well, and I find it very encouraging to hear about those supplements. Like you mentioned, they're over the counter, so anyone
Yes,
has access to them. And while you do want to make sure with your doctor that you're taking them in healthy levels and at the right dosages,
exactly.
it is something very practical, very approachable that anyone can begin doing once they
Yes,
refer speak with their physician about it. So that's really
yes,
encouraging. And
yes.
my goodness, I appreciate so much you being on the show, sharing your experience and your knowledge, and providing a lot of hope and encouragement to couples.
I really hope that everyone who listens to this little episode will find it interesting and they will get some sort of information. And again, I'm so thankful for being here with you today.
Thank you for being here, and we'll make sure to have a link both to the study that you mentioned and to
Yes.
your new clinic, so anyone in Ireland listening can know where to find you. So,
Thank you
uh,
so much, Caitlin. Thanks again.
listeners, we are so glad that you're here, that you're listening. I hope this has been a very helpful episode. If you prefer video content, you like to watch your podcast instead of listen, make sure to check out our YouTube channel at Woven Fertility. But otherwise, you can find us here or there every week as we continue to talk about all things natural fertility. As always, thanks for listening as we continue to explore together what it means to be woven well.